So I'm just going to take some vitals from Sarah here. First of all, I am going to do BP. So Sarah, is it okay if I take some vitals? Cool. So when taking BP, you're going to use this cuff. You want to make sure it's the right size. So this is just a regular adult size. So you want to pop it around the arm and line up roughly. Sorry, I'm just going to put that under here. With the artery for the left arm. And then you just want to do it up. You want to, first of all, you want to make sure you can see it, and hopefully this is the right way. And then you want to find their pulse, and then pump it up until you can no longer feel their pulse. It's about 120. So then we're going to let that down. Then we want to add about 20 to it, and that's how far we should pump it up to. Okay. So want to make sure that the patient has their arm relatively relaxed, otherwise this can affect the blood pressure we get. So having it resting is ideal. We're going to make sure the drum is going and put it just under the cuff to hear the beat. So I'm going to start pumping it up. I'm going to pump it to about 140 and then slowly let it go. So I can hear her heart start to beat at 120 and stop at about 85. So that gives a blood pressure of 120 over 85. So I'm just going to let that down, and then I'm going to take the BP cuff off. So that's within the normal range. Systolic is usually between 100 to 140, and diastolic is usually between 60 to 90. So now I'm going to do heart rate. So for this, I'm going to count for 15 seconds, and I'm going to count her pulse during that time. So I'm just going to find her pulse. So for her heart rate, I found that it was 20 beats in 15 seconds, which is you multiply the 20 by 4, which gives you 80 beats per minute. I also did her rest rate at the same time, which was 4 breaths in 15 seconds, which is 16 in a minute. Both those are within the normal range, so heart rate is usually between 60 and 100 beats per minute, and rest rate is 12 to 20 breaths per minute. So now I'm just going to auscultate. So for auscultation, we want to listen to the lobes of the lungs, both on the front and the back. So we usually do 6 points, which is at the apex of the lungs, on the bottom and to the sides, and then on the back as well. So is it okay if I just put under your shirt? So take a deep breath in. Okay. Okay. So move around to the back. I'm just going to pop under your shirt, okay? And breathe in again. Okay. So Sarah's lungs are clear in both sides, and I can't hear any wheezing, bubbling or crackling, which would indicate a pneumothorax or pulmonary edema of any kind. So with cap refill, you want to find a finger and just hold it down, and then you're counting the time it takes for the blood to refill. Sarah's is 2 seconds, which is the normal range. Anything outside this would indicate that blood is not perfusing well to the distal spaces of the body. So we've arrived at the scene of a man who's fallen 2 meters out of a tree. He was cutting branches, and we've established that the store is quite a few meters away, so it's not posing any hazards right at the moment. We've also checked for no loose branches hanging from the trees or surrounding the patient. So we can now enter the scene. Sarah and I both have our gloves and our glasses on for correct PPE. Are you ready, Sarah? Yep. Cool. Hello, sir. What's your name?
Hayden.
What seems to have happened today?
I was cutting that branch, kind of fell.
Okay. So I can see that Hayden is alert, his eyes are open, and he's able to obey commands, which is giving him a GCS of 15. He's also got a clear airway. He is patient, and he doesn't seem to have any obstructions. His breathing seems to be regular, and he's not hunched over in any way. He doesn't seem to be any kind of respiratory distress. Cool. I consider you've got quite bad bleeding. Is it okay if I just control it?
If you want to.
Okay. So with bleeding, you want to expose the wound, but Hayden's got a t-shirt on, so you can already see it. So we want to use saline on the wound to manage infection control and to kind of clear away some of the blood so we can see the wound. We then want to measure the dressing up to the wound about the right size with smallest surface pressure, direct pressure. We also want to put some saline on the dressing to make sure that not too much blood is absorbed into the bandage and it doesn't stick to the wound. We then want to apply direct pressure to the wound. We want to get our crepe dressing and start wrapping it and securing it around the affected site. Sarah, can you please do some vitals? Yeah. So once we've had it fully secure, we want to start getting it quite tight. So we want to twist it 360 and continue. Is it okay if I do some vitals on you, Hayden?
Yes, sure.
Right. This is with the aim of trying to stop bleeding altogether. So do you have any allergies, Hayden?
No.
Do you currently take any medications, particularly like blood thinners or anything?
No.
No? Okay, cool. How's his vitals? There. How's his vitals? Good? Yeah. One thing on aim. So we also want to make sure to check his pulse after we wrap it, to check that he still has circulation to his hand, which he does. We also want to check cap refill, just a bit slower than normal, but he's still getting blood perfused to his hand. We also want to elevate the wound to try and minimise the amount of blood flowing to the site. So now I'm going to go ahead with a rapid trauma sweep, just to check for any injuries or abnormalities that may be occurring elsewhere on his body that I can't see. So Hayden, is it okay if I just feel down your body for any injuries or pain? Okay, cool, thank you. So I'm just going to start at the top of the head, feeling around, checking for any blood, anything that doesn't feel quite right, checking the ears for any fluid or blood. I'm going to check the cheekbones and the jaw, feeling down the sides of the neck and the back. Is that quite sore?
Yeah.
Is it around the sides or in the middle? The back. Okay. So Hayden's experiencing some midline C-spine tenderness, so I'm just going to get my oscillator to hold his head while I continue with my sweep. Cool. So I'm just going to continue. I'm going to feel around the back of the shoulders, collarbones, and the arm. Is there any pain? There's no bleeding. I'm just going to pop this down for a minute, and then going to continue down the ribs. Can you take a deep breath in for me, Hayden? Cool. So the chest is rising equal and opposite on both sides, which is a good sign. So I'm then going to just check down the sternum. There's no bleeding. Any pain?
No.
No. I'm going to pop that back up there for you. And then going to just check his abdomen, as we can lose quite a lot of blood into the abdomen. Any pain? No bleeding. You want to check the pelvis, as you can also lose quite a lot of blood. Down the legs. Any pain?
No.
We want to walk around the patient as we want to minimise prime bleeding over the patient. So we're just going to check down his arm. Any pain?
No.
Can you wiggle your hands for me, your fingers? Awesome. So then we also want to check the spine and the lower back. Any pain? No. Feels okay. We're going to check down his leg. No blood. Any pain?
No.
Okay, so that's painful. So I just want to pull the pants up to expose the wound. So you can see it's like an angulated right ankle. So I don't want to continue any further with this, as there may be an ankle injury. From the rapid trauma sweep, I've identified midline tenderness in the C-spine and also the fracture. We want to deal with the C-spine tenderness first, as this can have serious effects if I don't stabilise the neck as soon as possible. When doing this, we want to establish whether or not we can use a collar, or we should be using a collar. We do this by using the nexus rule, which is that Hayden's not showing any intoxication, but he is showing midline tenderness. He's also got a distracting injury, which is both his ankle and his arm. He's not showing any focal deficit, but he also has no loss of consciousness. Okay, so when using a collar, we want to measure from the midway of the shoulder to the neck, using your fingers up to the bottom of the chin, which appears to be about 4 fingers. We then grab our collar and we measure from the bottom of the collar up to, it looks like short. So you just want to pop these out, and we want to slide the collar up till the red dot is on the short, and the red dot's on the short, and then you want to clip them back in. When doing this, we want, Sarah, if you just carefully lift Hayden's head just a little bit, and then we're going to slide this collar under. We're going to push it around right under his neck. Careful for any jewellery or piercings, but Hayden doesn't have any ears pierced. Then we want to pull it tight and make sure it's securely in place. We then want to pop this under his head to about 15 degrees, so he's in the sniffers position or the neutral line. That doesn't want to stick, but we'll just pop that under there, so hopefully it'll stay. Are you comfortable, Hayden? Okay. Okay, so Hayden, on a scale from 1 to 10, how bad is your pain? 10 being the worst pain you've ever had.
9.
Okay, so being a 9, it's clearly fairly severe pain. So for this, we're going to administer some short and long-term pain relief. Long-term being for to help minimise his pain during transport and once we get to the hospital, and short-term helping particularly with his splinting of his fractured ankle. So for the long-term, we're going to give you some paracetamol, Hayden. Do you have any allergies to paracetamol?
No.
Have you taken paracetamol in the last 4 hours?
No.
And have you ever overdosed on paracetamol?
No.
Cool. Okay. So we can administer paracetamol both using tablets and liquid form. So for Hayden, we're going to use liquid as he is in a collar, and this means that if he was to choke or vomit due to the tablets, it'd be more challenging to roll him on his side to expel the vomit. So with dose, we want Hayden, how much do you weigh?
69 kilos.
Cool. So for someone who weighs under 80 kilos and they're an adult, we're going to use 20 mils of paracetamol liquid. So I just want to do a drug check first, so I can see that it's clear and there's nothing in it. It's sealed. It's paracetamol and expires April 2020.
This is paracetamol and it expires in April 2020.
Awesome. Thank you. So I'm just going to draw it up to 20 milliliters. I'm just going to get Sarah to check it for me.
Yep, 20 mils.
Awesome. So we've established the right drug and the dosage, and that we are administering it to Hayden. We're going to administer it now, and we're going to administer it orally with liquid. Awesome. So just going to gently feed it through, getting him to swallow regularly. Now that we've done paracetamol, we want to move on to our short-term pain relief. So for this, we're going to use methoxyflurane. You use methoxy for moderate to severe pain, and it provides some short-term relief. So Hayden, I'm just going to go through some contraindications with you first. So have you seen this before? This is called a green whistle,
yes.
also known as methoxyflurane. Cool. Have you had it in the last 7 days?
No.
Are you allergic, or do you know of any allergies to it?
No.
Does your family suffer from malignant hypothermia?
No.
Do you have any kidney issues?
No.
And clearly Hayden is able to obey my commands, answering me as I ask him questions. So I just want to do a quick drug check. So we can administer up to 6 mils to an adult patient in 7 days, but we want to start off with 3 mils. So this is methoxyflurane, 3 mils, and it appears to be clear and it doesn't have anything in it. And it expires on the 12th of 2020.
This is methoxyflurane and it expires on the 12th of 2020.
Thanks, Sarah. So, Hayden, what I'm going to get you to do is I'm going to pop this on your hand, and I'm going to get you to hold on to that one. And what you want to do is you want to breathe in and out into the tube and pop your finger over it, the hole, for a stronger dose, okay? It might taste really bad, or you might feel nauseous, or even a little bit dizzy, but it will help relieve the pain, okay? So when assessing possible fractures, you want to expose both limbs. This involves taking the socks off. So Hayden, is it okay if I take your socks off?
Mm-hmm.
Yeah. So you might want to suck on the methoxy because it's going to hurt quite a lot on this ankle. Ready?
Yep.
Yeah. So I'm just going to carefully pull the sock off and pull the other one off as well. So we can see they both look relatively the same length. You want to check, this one looks quite angulated and unnatural. We want to check for pulses, so pedal pulses. I found that one. And then you want to find the other one too. So this demonstrates there is blood still flowing to the injured ankle. So we also want to check the warmth. They're both warm. This one's a little bit colder, but there's obviously still blood flowing. You want to check cap refill. It's about 3 seconds. About 2. You also want to check for sensation. So Hayden, can you tell me if you can feel this?
Yep.
And this one?
Yep.
In both?
Yep.
Can you feel that? And what toe am I holding?
Middle.
This one?
Middle.
Yep. Cool. Can you feel this one?
Yep.
This one? This one?
Yep.
And this one? Cool. Perfect. This one?
Yep.
And that one?
Yep.
Both of
Yep.
those? And that one?
Yep.
Awesome. Okay, so obviously Hayden's also experiencing quite a lot of pain in this ankle, which is part of the past disc rule. So Sarah, would you please measure up the splint? Yep. We're going to splint Hayden's leg. To do this, we want to measure from the top of above the knee down to the bottom of the heel. And during this, we are also going to realign the ankle. So I'm just going to get Sarah to help me by lifting up the foot. She's just going to put her foot under her hand under the foot and under the knee. And on the Hayden, this is going to be really painful. So 5 deep breaths of the methoxy in and out. And I'm going to count 3. 1, 2, 3. Ready, Sarah? Pop that under. I'm going to try and realign it at the same time. Perfect. So I want to do this quite tight to make sure that we are structuring the ankle. And then we're going to reassess the baselines. Check the pulse is still there. It is. Still roughly the same, quite strong. Cap refill. Still about the same. Can you feel this on both sides?
Yep.
Awesome. And watch out my body.
Good.
Awesome. So I've noticed that Hayden's arm is bleeding through the bandage again. So I'm just going to get my partner to re-wrap his arm. I'm just going to re-wrap your arm. Is it okay? This is to apply more pressure to the arm and hopefully it will stop bleeding. However, if it doesn't stop bleeding, we can use a tourniquet. Tourniquets are the last resort. We'll try to do everything before we use one of these. They can be quite painful and they will require some really strong sedatives, painkillers. When using a tourniquet, you want to apply it 10 centimeters above the wound site, preferably on a single boned limb, to ensure that you cut off the circulation from the artery. So the arm hasn't stopped bleeding and we do need it to stop, so we're going to use this tourniquet. So Hayden, is it okay if I just put this on? It's going to be quite painful, so you're going to want to suck on that Nafotzi as much as you can, okay? So we're going to flip it over the arm, up onto the single bone, about 10 centimeters above approximately, and we're going to do it up quite tightly. We're then going to pull off and we're going to tighten it up to basically as tight as you can do it, and then you want to date and time it, so it is 5 to 2. This is important for the hospital when they do take it off. We then want to recheck his pulse. Can't feel any pulse, and we want to check his cap refill, and it's very, very slow. So this is demonstrating that the blood is hopefully no longer entering his lower arm. So then we're going to take the bandage off to expose the wound to ensure that it is not bleeding. Cool, so we can see that it has stopped bleeding. We're going to check pulse, no pulse, and cap refill is still really slow. If it hadn't stopped bleeding, we would attempt to apply another tourniquet proximal to the centre of the body, just above the first one, and hopefully reach the artery and occlude it fully. So Hayden, I'm just going to reassess your pain. So like earlier on a scale from 1 to 10, how bad is your pain?
7.
So 7. So it's still quite bad pain. So at this stage, we would consider calling for paramedic or ICP backup that can administer stronger pain relief for our patient here. This would help make his trip to hospital more comfortable. We also want to make sure we watch out for hypovolemic shock. To do this, we want to make sure we keep the patient warm, placing a blanket on them. We also want to oxygenate them and give them fluids to maintain their BP.